So I'm the Crook County Public Information Officer, and for the Health Department, I am the Emergency Preparedness Coordinator, and I manage any incident with a health-related component, so this pandemic falls into that category for me.
Can you just speak to, in summary, this particular incident that I'm asking about?
The one death that we have that is recorded on the state website, we have not received the official investigation report from the sheriff's office or the medical examiner's report. It was a presumptive COVID-19 case that was a contact of positive confirmed cases. She was isolating, and we had checked in with her day before yesterday. She seemed fine, and then yesterday we got a report from our local law enforcement indicating that she had passed.
So she was not hospitalized?
She was not hospitalized. She had minimal symptoms, and we had actually thought that she was into recovery with her symptoms. She never got bad with her symptoms.
Was this person's, did they have underlying medical conditions that were exacerbated?
None that we're aware of, and none that the state had recorded either.
This person had gone into isolation as a result of contact tracing, is that correct?
That's correct. She had contacted us and had been around confirmed cases out of the state of Oregon, and when she returned home, she isolated immediately, went to her doctor, and the sampling was taken here at St. Charles in Prineville and sent off to the Washington State University lab. We're awaiting those results and hoping that we get the official result today or tomorrow at the latest. But as being a direct contact to 4 confirmed cases, she classified as a presumptive case for Crook County because she was symptomatic.
You said she traveled out of state. Can you identify the location she came into contact with these positive cases?
The family owns a second home in California, so she was visiting there.
As the county's health department public information officer, what should the public take away from this event be?
I think that this may be a real awakening for Crook County because we have had such a low case count at this point. There may have been a false sense of security, and people just need to recognize that the virus is still out there. It's still going strong. There's no sign of slowing, and we are starting to see more and more cases popping up here in Crook County because of large gatherings and people coming in. We are a high tourist area, so just over the 4th of July weekend, I came into town and I actually saw license plates from 8 different states. So we do have others visiting our area. So our local community just needs to remember to protect themselves, to protect their loved ones, wear the face coverings, wash their hands, use the hand sanitizer, and practice social distancing.
Thank you. That's all I had for you. I understand you're very busy, so I will try not to take any more of your time unless there is something that you think I need to know or something I didn't ask that's important to this story.
You can feel free to contact me over the next couple of days and see if we've received the official report back on her test results. I'd be happy to share that with you.
And because she was in isolation at the time she passed away, you're not having to do any additional contact tracing within Crook County?
Not with that particular case. We have other cases that as we get either a direct contact or someone who has been tested positive, then we continue to do our contact tracing on each individual case as it arises. Hers, there was no indication that there was anyone else that was exposed to her. She had come straight home and isolated immediately.
Thank you.
Sure, you're welcome. Thank you.